Tree Country 1330 WTRE. It is 8:34 on this middle of the month. Sean Durbin's with us with the Decatur County Health Department. Can you believe it? It's the middle of October.
I know, it's so weird. This month is flying. This year is flying by. Didn't this year just start?
I think it did, and now another one's knocking on the door.
Yeah. I'm getting all my 2026 plans together, as a matter of fact. So that's what I want to talk about today.
That's right. You guys have a lot going on.
We do. One of the main things I want to talk about is on October 24th, Friday, we will offer some extended hours. We'll be open till 6 o'clock. So from 9 to 6, we're going to do a drive-through Boo to the Flu.
Okay.
So this is an opportunity for people to come out and get their flu shots without even getting out of their cars. So you can bring your, if anybody has any mobility issues, it's great. If you have a van full of kids, it's great. We'll do it right there in the car. You don't have to come in. We'll have some little visuals, I guess, for people. Everybody's going to be in costume and everything to help tie in the October 31st Halloween holiday. And so we'll make it a fun event. So bring the kids, bring everybody, bring up a carload.
And it's open to any age?
It is open to any age. That's right.
Will you have the high dose there as well, or no?
We do not have the high dose.
Okay.
So
that's okay. We just need to check so we know what we've got.
Yeah. So.
And it will only be flu shots that day.
It will be just flu shots that day. We need to exclude anything else just so we can keep it moving and keep taking care of people. So
all right.
Every other day, come on in and get your other shots.
That's right, but this one's just for the flu.
This one is exclusive to the flu.
All right, and that's next Friday, the 24th.
That's correct.
All right, very good.
Yeah, we're excited about it.
What else is on the docket down there at the health department?
So one of the things I wanted to talk about, and one of the main things, and it really is a great focus on the health department, and it really talks about what we do, is our Decatur County Health Plan. So this is the official health plan for Decatur County. This was adopted by the commissioners at the last meeting. And what this is the focus on really the next 2 years for the health department. And I think a lot of the listeners probably know that we had some pretty significant cuts in funding to the health department. So what we're looking at is some creative ways to help the health of Decatur County and still stay within our budget. So we need to be really fiscally creative, but we also want to be creative in the ways that we go about doing this. So that we had a set of metrics provided to us from the Indiana Department of Health, and we used those to kind of determine where we wanted to focus on. And in some areas, Decatur County does extremely well. In other areas, we're not doing so well. So the ones that they came up with were adult obesity, and our adult obesity rate is 46.4%, while the Indiana rate is 44%. So that's a pretty high percentage of Decatur County residents who are at the obesity level. And that ranks us at 45th in the state, in counties in the state. And then children under 3 years old who have completed their routine vaccines, we're at 74.3%. The state's at 62.2%. So good for us. We're number 9.
That is a great spot to be in.
Yeah, and one of the really nice things, I just saw a metric just this week that as everybody's probably aware, there's some pretty severe measles outbreaks going on. You need a 95% vaccination rate in order to achieve that herd immunity. Everybody remembers hearing herd immunity from COVID, herd immunity. Well, I'm really happy to say that we're at that percentage in Decatur County. We are one of the highest in the entire state and one of the highest in the whole country, to be honest with you.
Oh,
so that's really good news. It does not mean we can't have a measles case here, but the good news is the chances of it spreading among unvaccinated people is very low because there's just not that many of them. So kudos to the parents who are getting their kids in, and that's great. So going on, smoking cigarettes during pregnancy. We're at 11.5%. 11.5% of the mothers who are pregnant right now are still smoking. The state's at 5.3%, and unfortunately, that puts us at 82nd in the state among counties. So
that's we're double
we're
Indiana
double
rate.
the state average. So moving right along, infant mortality rate at 8.48%. The state's at 6.7%. So that we're not doing very well there either. And so that puts us at 64th. Life expectancy, we're at 74.5%. The state's at 75.6%. That puts us at 64th. And talking about life expectancy, some of the things we're talking about here are the very things that lower that life expectancy. So if we can improve rates in these other areas, we're going to improve life expectancy. Opioid overdose rate, we've seen some improvements there, but we still rank at 59th with a 21.8% overdose rate.
But lower than the state average,
and
right?
we are lower than the state average. However, we still rank low on counties. Yeah, one is too many, right? I mean, it's a completely preventable, as are many of these. And our suicide rate's actually pretty good. I mean, again, there's no such thing as a good suicide rate, but we're at 13.5%, while the state's at 15.77%, and that puts us at 16th. So we're doing pretty well there, and we have some programs actually that address that now, so that's good. And then years of potential life lost. This is kind of a funny little statistic that's a little bit hard to explain, but I'm going to do my best. But we're at 1,594 per 100,000 people.
Okay.
The state is at 2,527 per 100,000 people, and we rank 17th. So we're actually doing pretty well there. Now, years of life lost. I'm going to do my best to explain this. So this has significant economic consequences in Decatur County, because every year of life lost is one less year of somebody being able to earn an income, to be able to be productive to society, to be able to work and help a business. So these have direct consequences on the economic side of Decatur County. So what we do here in order to do this, and I had to write this down because I never explain it well. So it's an estimate of the average years a person would have lived if they had not died prematurely. So we use 75 years.
Okay.
So if a person dies at 74, that's 1 year of life lost. If we have a person who died at 60, that's 15 years of life lost. And this is due to injury. So what we look at there, of course, is car accidents, farming accidents, just about anything that can cause a fatality and an injury.
Okay.
And so I guess I don't know if I explained that well enough, but we can move on at any rate. So what we've done in Decatur County is we've looked at these. We've looked at the ones that were our worst performing by county, and we have selected cigarette smoking during pregnancy, infant mortality rate, opioid overdose rate, and adult obesity.
And those are going to be your four main focuses.
Those are our four main focuses. Those are big things.
Those are huge.
And those are not things that, it's a big ship, as they say, and it doesn't turn around quickly. So these are things that this is actually a 2-year plan. We'll come up with another one next year, but I anticipate it focusing on the same ones, because I don't see these dropping drastically within 1 year.
These are all take a lot of education.
That's
exactly
to
turn that ship
right.
around.
That's exactly right, and that's part of our plan. Is the education aspect of it is a huge part of it. As we look at like cigarette smoking during pregnancy, we will be able to offer smoking cessation aids, not directly, but through other agencies. Much of our plan relies on, because again, the budgetary constraints, we're using partners to help us with that. So like Quit Now Indiana, it's a wonderful resource. They will provide free smoking aids, consultations. They will bug you to death about quitting smoking, and they're great. They're actually very effective. It's one of the best tools we have right now, so we love them. So
now with that, how early are you guys able to intervene? So are you working with the OBGYNs in the area? How do you kind of intervene on this particular one, since it's cigarette smoking with pregnancy?
Yeah, that's a great question. So what we'll probably typically going to focus on here is reaching out to the general public to start with. We already partner with Decatur County Memorial Hospital. and they also do a great job of referring people to resources. So we'll work in conjunction with our partners to help identify those people. So we partner with Decatur County Memorial Hospital. We partner with WIC. So we'll do some education with both our partners, and then hopefully reach out to the general public through media and social media and let them know that we have resources available. So it's going to be a little hard to target directly those people because sometimes that data lags a little bit. So getting that reporting, it's not like a doctor calls us up and say, hey, I got a person who smokes, you need to reach out to them. However, the doctor can say to that person, hey, Decatur County Health Department has some resources for you. Go see what they can do. So that's kind of the outreach that we'll be doing on that kind of thing.
All right.
So, and we have a very detailed plan here for 2 years that addresses each one of these. So our goals here specifically are to reduce the smoking during pregnancy from the 11.5% to 10%. So again, it's not a huge goal, but we're trying to be realistic using the data and using the past data so we know what kind of declines we're seeing, which unfortunately haven't been much in the past. So while a 1.5% decline doesn't sound like a lot, it's huge for that baby.
It is. Absolutely.
So that's kind of what we're looking at here. Infant mortality, so we want to go from the 8.48 to 8% live births. That's per 100,000. I'm sorry, not percent. Again, it's not a huge number, but we feel like it's doable. That's one of the things we want to be realistic. There's no point in saying we're going to take this down to zero because you can't take it down to zero.
There are things you just cannot control.
Correct. Overdose deaths, we want to achieve a modest reduction. So a 5 to 10% reduction on that. So again, it's not huge, but we look at the available tools we have and the problems we have in the community, the issues we have in the community that lead to overdose, and we realize again that this is not something that we can change drastically overnight. So we're trying to be realistic on these.
I think too, when looking at these 4 big ones, that opioid overdose, that is one. There are so many different aspects to approach to get that improvement?
Yes, there are. And one of the main ones, and one of the ones we've already been doing, and I am so proud of my team for making all this happen, is our naloxone, the overdose rescue drug, making it available to the communities. So we not only have nalox boxes at Decatur County Health Department, we have one at, I'm going to try and remember where all they are now. I believe there's one at the ARC. There's one at Decatur County Library. I know I'm missing one in town still, but we just recently put one up in St. Paul and in New Point. So these are boxes that have naloxone. There is a standing order that anybody can use naloxone. We love to do naloxone training because it is important to know how to use it. But the instructions are there. So people can use this without training. It's very simple. But this is, if everybody carried naloxone, if every person in Decatur County carried naloxone, we could reduce overdose deaths drastically because it is proven to be a rescue device for opioid overdose. So
when you talk about those boxes, we were just talking about budget cuts and constraints. Where does that funding come to supply that throughout the county?
Fortunately, for right now, we do have 2 grants available that supply the naloxone for us. They're not monetary grants. They're actually direct naloxone grants. One of those is through Overdose Lifeline, and the other is through the Indiana Department of Health. So the Indiana Department of Health we utilized to put naloxone into first responders' hands. So that's available to any fire department, police department, EMS, anybody like that. And then the Overdose Lifeline is the ones we use to stock our naloxone boxes. So.
All right. That's just a big one, and I think
it
collectively, though, it can be reduced.
It is, and we need to reduce the stigma on this. I still run into people. It's getting better. It really is. It's getting better all the time. But we need to realize that opioid use is a disease. Opioid abuse is a disease. This is it actually physically changes a person's brain. And this isn't something that they can just will themselves out of, because they actually have physiological changes that happen that make them continue this addiction. And we need to address it as a disease, and we need to realize that I still have heard people say, well, naloxone's just going to encourage people to use this. We put up one of our boxes, and that post was on social media, so I'm going to address that person. No, it doesn't. There is nobody in the world who says, well, now I have naloxone, I'm going to overdose. It just doesn't work that way. And we don't complain about other rescue medications, right? People have nitroglycerin for their heart disease. That's a rescue medication. When they have their angina, they can put that under their tongue. This is the same thing. We have a rescue medication for a disease to keep somebody from dying right there. And that's the way I look at it. So
we're hoping it continues to work.
Yes. So anyway, I guess I should probably move on to the rest of them. I guess I only have one more. Adult obesity, and you talk about one that's going to be a hard one to change. We have a multi-step plan. Again, all of our plans, all of these, because one, we're trying to be fiscally responsible, right? This is your taxpayer dollars that we're talking about here. Whether this is a great deal of our funding comes from the state, some comes from the county. Either way, you're paying the taxes for these. I'm paying the taxes for these. I want my tax dollars to be effective. Everybody wants their tax dollars to be effective. So that is our goal here, is to make sure those tax dollars are effective, and we're not wasting your money. So what we're doing here is we're actually partnering with many of our community agencies that already exist, and our state agencies that exist. So the main thing we've already done in this plan, and we will continue to do, is we want to use data to determine where we need to be and to determine what our successes are. So if you don't have data in public health, you really don't have anything.
That's the whole root of public health.
It really is.
Yes.
That is exactly what drives us in pretty much everything we do. So then the next part is we want to be really creative in how we approach these. So we're using those strategies to help us come up with a measurable outcome, a way that we know we're either succeeding or we need to change course, which changing course is not a failure. It means that we need to change course. That's all it means. And then we need to, of course, expand our current services, both internally and reaching out to those partners through memorandums of understanding that, they will do this and we will do this, and helping them with some of the resources, and them helping us with some of the resources to help achieve these goals.
I think, too, when we talk public health and you're talking about it being measurable, explain that to people at home that may not understand that exactly. So when you're talking about that, it doesn't just say that you're going to encourage Decatur County residents to walk more. That's not a measurable outcome. That
is not a measurable outcome. That's correct. And obesity, it's actually fairly straightforward. So this data does come from doctor's visits, basically. They are anonymous, but we do get collective data from when you go in for your doctor's visit, you step on that scale. That data gets sent to the Indiana Department of Health. Again, it's not identifiable. It doesn't say that Sean Durbin needs to lose 20 pounds. It doesn't go there. But it does talk about the collective obesity rates. So we get that data from the Indiana Department of Health, which comes directly from medical visits. So it's very accurate. It's very timely, and we can see a true measure of what that is. And that's the kind of data we need. The true measures. We do things that feel good. There's no doubt about it. We, as a health department, we do things that feel good. But that can't be our sole focus. We need to know where to go with this using that data. So we rely on a lot of data from multiple sources. Indiana Department of Health is our main one because they have the personnel to collect that data, the personnel with the expertise to collect that data.
Now, this whole plan, is it on file where if the public wants to see it, they're able to review it?
It is not, but we will put it on our website. I just got it passed at the last commissioners meeting, so that is the plan. So this will be the document will be available to review on our website, and we would welcome public comment on this as well. It's a little too late to change it, but right now. But that doesn't mean that when we look at this and we look at our multi-point plans here, if somebody calls in and says, hey, I got an idea, why don't you do this? We can include that in this plan right now. It's not going to change in the written plan, but it may change our focus and where we go with that.
I think, too, being able to look at the statistics that are in here, it gives a much better representation of what our community looks like. But then it's also, like you said, making you accountable for tax money, making you a good steward of the tax dollars that you do get to make sure you're supporting the community.
Oh, that's a great point, and I appreciate you saying that, because that is our goal, of course, all the time. That's why we want to be transparent about this. It's why we put out a health plan, is so that the public can see it, so that the commissioners can look at it and they can say, yeah, this is a good thing for the health department to be doing. This is where Decatur County should be spending their money and their focus. It's not just money; it's our focus. The two are hand in hand, but yeah. So.
Now, this is good. It's kind of a 2-year timeline for this one. How frequently are these generally done? Like, when was the last plan before this one?
So we do it annually. This is the first time I've come on here to talk about it. It was one of the requirements of the Health First Indiana bill. So it was kind of done, okay, I'll send this to the state and they'll either okay it or not. And then this year, I really wanted to get more buy-in from the entire county. So that's why we approached it this way, and that's why I'm talking to you about it. And I'm really excited about it. I think it's a great plan, and
it gives a lot of information. I think, too, you and I are kind of in the community in different sectors, so we know kind of what's available to get people help. But for someone that is not maybe in a healthcare role or public role, they don't always know what's out there.
That's right. That I think is one of our largest problems, as a matter of fact, is the resources that are out there are vast. We have a lot going on. If people are not following Decatur County Memorial Hospital, they should be, because they have some incredible programs that impact public health directly, and really help us a lot to help achieve these goals. I said help twice in a sentence. So they're a great partner, and we appreciate everything they do, and especially in some of those long-term chronic issues that they're addressing through education and really putting their money into this, because those are pretty big investments for them as well. But they realize that if we can improve on these metrics, if we can improve individuals, we improve public health, and public health improvements reduce medical costs and medical resources.
All right. So once again, you're going to put it up on your website at some point?
I will put it up on my website.
All right. Very good. So it's available to be looked at by request. And if you've got questions, they can call you.
That's exactly right.
All right.
I look forward to those calls.
All right. The phone number is 812-663-8301. And we don't want to forget Boo to the Flu.
Boo to the Flu. Show up on Friday the 24th from 9 to 6. We'll have extended hours. So bring those kiddos. Bring anybody you want. Load up the car. Bring them in. We love to see a van full of people come in.
Makes you happier, right?
That's right.
That's it. Well, Sean, thank you so much. That was the quickest half hour ever.
Well, I'm sorry. I talked a lot.
That was good,
that was
though.
a lot there.
There's a lot there. It's a lot of good information. Thanks for being in with us this
Thanks,
morning.
Emily.
It's 8:57 on Tree Country 1330.